installation in Tamil Nadu, we have captured the data, and the same data is now taken. The government of India is very serious to take this data into the UID. So that transformation is happening, which will be the very crucial factor for a country like India having a mass population. It's in the transformation.
And basically, insurance products for the individual will always get linked to, I think the first basic product will be linked to the UID, because health is one thing which is constant. The need for a health cover would be constant throughout a person's life. Other properties could come and go. So, the constant factor as we go along could be that UID.
Just wanted to add, Manik works with Milliman, so that's why he also knows that, like for example, in some markets, I hate to use always like refer to the US, but it's over there you can get data for 13 million lives, the same lives for the last 8 years. Next year you'll get it for 9. They started a program where about 8-9 years ago they said, okay, we're going to take a chunk of people, we're going to get their status at the point of enrollment, whether they have a pre-existing disease or whatever it is. So you have all his information at time of enrollment, what was that person's health status. Then for that person, you have the next 8 years. And that also includes primary coverage. So every time he had a flu or he had a stomach problem, that's there. What drugs he took, okay, and any hospitalization that happened, okay. And that data is commercially available, and it's not very, very expensive, and it's easily accessible. You get it on DVDs because it's quite a bit of quantity, and you can load it into any kind of system. You can do any analysis. For example, our company develops an underwriting product which uses that as the foundation data, and it also includes cost. So it's not only an incident of a disease or anything, but what was the cost when it transpired. So something like that, where you have a unique identifier, where you track people across time, and you build this sort of database, it has a lot of value in many, many ways. Maybe we do 2 more questions and then 1 more? Okay. Yeah. When one hand is up, we'll just do this last one. I can take that.
So is there a forum which is going to now define certification for such systems? For example, you say the EMR vendors may need to be compliant with this standard forms, right? So is there a next step, like you need certification to get into, be certified that this is a standard?
See, the forms are being standardized, and the format is being made compatible with electronic format. And once the industry adopts, see, the claim form is issued by the insurance company, right? It's specific to an insurance company. So once the claim form is standardized or the pre-authorization form is standardized, it will be rolled out to all. There is no certification required as such. Only at the hospital end, the compatibility to provide the information in that format only would be required. Number 1. Number 2, specific to the billing and the discharge summary, that of course would come from the provider end. Their system, they may have another set of bills, or the discharge summary may be more detailed for the patient. But for submitting it to the insurance company, the information should flow in that format. That's about all that is required. So someone any provider wanting to being a part of the insurance network, so cashless network, empaneled provider would use those formats for providing the bill and the discharge summary. Claim form and pre-authorization in any case would be rolled out from the insurance company end, right?
Okay. No, my question primarily was because, you give a format and there's a company A vendor and a company B vendor. Maybe they have different interpretations of the same format.
No.
That form would not be vague like that. It will be very specific with 1-digit box for each, information.
Yeah, there's a lot of supporting documentation which explains every field and everything. Right. And our method of certification is different. Like I was saying, we'll be working with eHealth, to put the information out there, so the buyers are knowledgeable about what should be achieved, what the insurance companies and the TPAs want,
Okay.
and they will ask you as a vendor of EMR application, will your application achieve this? Okay. As an industry or anything, we don't get into that standard setting. All we do is tell our expectations that if you want to work more smoothly with us, give us data like this.
Okay. Okay, thank you.
Sorry, I didn't really get you at the last part. Yeah. Right. So good news is that we do have, pretty soon you should hear the official launch of the HIMSS India chapter in India. Okay, and I think that will be our affiliates that eventually will help us to bring the CP HIMSS, this certified professional, okay, in the healthcare information and management system side into India here.
And Stephen, I just wanted to know, because we answered all of these questions, are we almost certified now?
Until you take the exam.
Good, thanks. Service part is always robust. That's the easiest thing. They do it every day. Very few complaints. You don't get many complaints, do you?
But I'd answer that. See, technology, setting standards and all would bring about, there would be a lot of commonality amongst things. But ultimately, the people and how you follow up and deliver those processes, which is going to differentiate, companies. I think that will be the final differentiation point there. A lot of standards and all will bring a lot of commonality on platforms and stuff like that. But the software element, which is people dependent, will always remain there.
We could have answered you better if we had a panelist who was deficient in services, who could tell you this is what I'm going to improve. But unfortunately, all of these panelists are very capable in the services they render. Thank you.